My name is Dr. Lucarelli, and I'm an internal medicine doctor. I think the challenges to transitional care, I think, are discussed a lot by hospitalists. And patients are transferred. Often, if they have a long hospital stay, they're transferred from one team to another, maybe from the ICU to a regular medical floor. And data and information doesn't always follow them the way you would ideally like it to. So it may just fall through the cracks. The accepting physician may not get all the data and information that would be helpful. I think communicating with the outpatient team is another challenge that a lot of primary care physicians are a little frustrated sometimes with the discharge summaries they get. They include information that they don't need and not enough information that they do need. So really developing this skill to communicate with the outpatient team is a challenge for the discharging physicians. I think access to care after somebody leaves the hospital, equity among communities, financial barriers. I think one thing that's really important is to understand, what the barriers are and what might keep your patient from being able to adhere to your recommendations, because that can be very frustrating for everybody, for the family, for the patients, for the physician, when they have this wonderful plan, but it doesn't happen for one reason or another. Those are I think, kind of the biggest challenges. Many of the challenges that happen with discharging patients could be assisted by AI and overcome by AI support. There's been some interest in these large language models that can actually write and write summaries. So I think that having some assistance with creating a discharge summary that's really to the point and includes all the pertinent data. If the patient's been in the hospital for a long time and there's a lot of data there, if it can look through that data and really make it available in a clear format to the discharging physician, I think that'll be really, really helpful. I think monitoring in the outpatient setting is another way that AI is being used and is going to be used for support of patients at home who may not necessarily be sick enough or want to be in the hospital, but do need some form of monitoring, and that the AI can provide very early alerts when it sees some changes that may predict a poor outcome or a decline in their status. So I think those are two very useful ways that AI can support patients in that transition. Just for HIPAA concerns, what I think will happen over the next 5 to 10 years is hospital systems will end up creating sort of on-premise AI so that the data is safe. And I think that's really going to have to be, pretty important before we can really get patient-level support in diagnosing and decision-making. Implementing AI will come with both some cost and some benefit. I think that it's important to understand the costs and the benefit and make sure that it's the right system for that particular health system. I think there's a lot of over-prescribing that can happen, as well as things that get missed. Often we're all sort of very worried about things we might miss at the time of discharge and that don't get followed up. But there's a flip side to that sometimes we can be a little overly cautious. So I think that in terms of cost of care, I think it might be AI may offer some exciting options for helping prevent overuse of resources. Hospital oversight may be another area where AI can be helpful. Hospitals can gather data on their individual sort of performance. I think some of the rating systems for hospitals, there's been a lot of talk about it not necessarily being strictly fair or accurate. But if you can gather more data and really look at this, AI might be helpful in really giving valuable feedback to hospitals, how they're performing, and individual doctors, how they're performing too, as far as both quality and cost of care. I think for one of the future concerns that we would need to also address if we're going to use AI widely is that physicians, I think, will need to have a little bit of a learning curve in how to interface with AI. There are some tricks to working with AI, and I think doctors and healthcare systems will need to be aware that there is a certain learning curve. It's not just automatic that everyone will be able to right away be able to use AI at peak efficiency. So those are some things to keep in mind for the future.